We're pleased to be hosting today's presentation, Advanced Health Care Directive, Respected Decision, which emphasizes the importance of planning ahead to have care decisions respected. Topics include choosing a healthcare agent, having conversations with loved ones, and completing an advanced healthcare directive. Matthew Parcasio, MA in Gerontology, is an outreach and education staff member of the Health and Community Engagement Team at the County of San Diego Health and Human Services Agency, Aging and Independent Services. Matthew gained his depth of knowledge of caring for cognitive and memory care impaired persons through his extensive professional experience in adult day healthcare, assisted living memory care, and non-medical home care settings. He expresses his passion for helping others in the support, education, and resources he provides to older adults, dependent adults, and their families in San Diego. So without further ado, I'm going to please all of you and turn my camera off and turn it over to Matthew, who's going to bring up his PowerPoint presentation. And Matthew, thank you again so much for joining us, and the show is for you.
Thank you so much, Mark. I appreciate the opportunity to return to the Retired Employees of San Diego County meeting, and thank you so much to all of you who have joined us this morning to hear a different topic today. And I was here with you not too long ago talking about our Aging and Independent Services programs and resources, but I'm here to touch on another topic, which is certainly a very important topic, near and dear to my heart, and as far as the importance of having your healthcare decisions and decisions respected. So I hope that you find benefit for today's presentation. Before I go any further, I just wanted to disclose that the information today is not legal advice, it's not medical advice or medical recommendations or how you should complete an advanced healthcare directive. Really the goal today, my hope for you is to stress the importance of making sure to complete one, having the conversation, and documenting the importance of your decisions with regard to healthcare. And that's really my goal and intent today, and the importance of the presentation. So again, I can't thank enough Mark Nanzer as the Executive Director, as the Retired Employees of San Diego County, and you all as members for joining us here this morning. So I'm going to go ahead and get things started, and I'm going to go ahead and share my screen. All right, so thank you again. And today's topic is Advanced Healthcare Directive, Respected Decisions. And today's presentation, again, is brought to you by the County of San Diego Health and Human Services Agency, Aging and Independent Services. So my role, again, at Aging and Independent Services is in outreach and education. You also heard from my colleague, Hazel Quinones and Annabelle Kirkendall, on other topics that we do in our community with regard to scam and fraud, elder abuse, mental health topics, and of course you'll be hearing today's topic on the Advanced Healthcare Directive. I'm so happy to see our videos and views on the ResDec YouTube channel to view for future reference and viewing as well too. So I can't thank you enough for allowing us to share our information with you today, and for future, for other members who aren't able to attend this morning. And of course, I can't stress enough the importance of the LiveWell San Diego vision. The LiveWell San Diego vision is a vision of our region that is building better health, living safely, and thriving. And as I mentioned before in the presentation that I initially did with you all, is that our programs at Aging Independent Services encourage older adults and adults with disabilities to build better health, live safe, and thrive. And the Health and Human Services Agency does its best to serve all 3.3 million San Diegans, including you all, to live well. And again, if you are interested in perusing our website, you can visit us at www.livewellsd.org. If you go to the far right of the livewellsd.org website, you can view a topic, and you can also toggle on aging. The Aging has information on our Age Well San Diego initiative and Aging Roadmap. So if you're interested in viewing that information on our efforts towards making San Diego age and dementia friendly, or what we like to consider living well to age well, you can visit us on our website. Now, let's get right into it. What is advanced care planning? And what advanced care planning is 5 steps. Really just starting to think about what type of care you may want and what type of care you may not want down the road. You may have already started to think about this. You may have started to think about these decisions and types of care for whatever reason. But really just to start to get a sense of what you would want and not want with regard to healthcare in the future. And then quite possibly learning about the different types of medical procedures. If I had a particular condition, what type of care, where would I want the type of care, and those critical choices and decisions to learn about to be able to then decide what you want and don't want. And then once you've decided on the type of care, maybe even quite possibly the type of end of life decisions that you would want, is to have those conversations or have the talk. Probably one of the most difficult parts of the whole process is to have the conversations and to really sit down with a decision maker that you've chosen, a trusted person, a family member, a loved one, a church member, a friend that you've said, if something happens to me, I want you to be that decision maker to make those choices or express my choices and decisions on my behalf. And then once you've had those conversations, is to document it on the Advanced Health Care Directive. And what is the Advanced Health Care Directive? It's the California version of the Advanced Health Care Directive is a 12-page document, which allows you to basically choose a primary and an alternate decision maker. It allows you to document all of your healthcare choices. For example, whether you want a particular medical procedure or whether you don't want a procedure, to life-sustaining measures. Ultimately, if you do decide to want CPR or not want CPR or want full life-sustaining measures if that time were to come, and even quite possibly what your end-of-life decisions are. And we'll get into those in a little bit later in the presentation. And once that Advanced Healthcare Directive is completed, to sign the document and or have two witnesses sign off that you've completed the document, or you can also have it notarized. So again, 2 witnesses to complete it, that you've completed it, or notarized. Now, we labeled this presentation Advanced Healthcare Directive Respected Decisions, because that's really what it's all about, is really to respect your decisions, to honor your values and beliefs, not somebody else's, but really your beliefs and what decisions that you want for yourself in the future. Because the great thing about it is that you can change those decisions at any point. You can decide to have a type of healthcare decision at one point and maybe quite possibly rip up the whole Advanced Healthcare Directive and change your decisions and have that conversation to confirm that altogether with your decision maker down the road. You may want to choose to have pain free and discomfort if you had a medical condition, really wanting to have a good quality of life ultimately up until the very end, because really, again, it's about empowering you to make those healthcare choices, document it if and when that time comes. Some quotes that I really enjoy that really bring to light the kind of planning ahead, although sometimes easier said than done, is planning ahead is bringing the future into the present so that you can do something about it now. And really the planning process should begin when someone is healthy and even young. Interesting enough, at the California State University at San Marcos, they have one of the nationwide leading Institute for Palliative Care. And they have actually promoted the encouragement of students to complete an Advanced Healthcare Directive. So you imagine a student who's 19, a freshman, or 22, or 32 as a student there at Cal State San Marcos, and encouraging them, even at their most healthy state, to complete one. If you would just imagine, maybe a student might be living by themselves and away from their family and loved ones and decision makers. What would happen if an emergency situation were to come about? And what healthcare decisions would they want at that point? So just noting that decisions and healthcare choices should be made as soon as possible. And learning about that, and in this 5-step process, and learning about the different types of care and choices that people would want to make. If someone has been diagnosed with let's say a chronic illness, for example, that they may want to choose palliative care. Now, some of you may be hearing that term palliative care for the first time, or some of you are familiar with palliative care. To palliate means to make less severe or make pain less severe. So in the words of Dr. Sharon Hamill at the Cal State CSU San Marcos, professor of psychology, the best, and I really so appreciate, and I asked that I quote her on what palliative care is. It really takes care of the mind, body, and spirit. And that's how she summed up what palliative care is. Because really what it does is it provides relief from pain and other distressing symptoms of a serious chronic illness, such as maybe diabetes, hypertension, heart disease, arthritis, but it ultimately doesn't cure it. So what palliative care or palliative care team would include a physician who specializes in palliative care, a nurse, social worker, spiritual counselor, as well as a pharmacist. And this really interdisciplinary team will help to address the needs of a patient and their families in the hospital setting, for example. So they'll really go over goals, symptom management, and also cover advanced care planning and completing an advanced healthcare document. Now, some of you may be familiar with hospice care. Hospice care is a specialized care that really focuses on supporting people during a life-limiting illness. So really the goal and intent of hospice care is really to provide comfort and quality of life. So not ultimately, again, like palliative care, its intent is not to find a cure to the illness, but really to make comfortable and really make each day successful and dignified for someone as long as able. And typically hospice care is introduced usually when someone's life expectancy is at 6 months or less, and or determined by a doctor. So it may not be 6 months or less, but there could be a diagnosis, for example, of advanced Alzheimer's disease. So that potentially could be one qualification of receiving hospice care. So like palliative care and hospice care, both are covered by the Medicare and Medi-Cal benefit. Palliative care, as I mentioned earlier, actually may be covered by some private insurance. So if you have a private insurance and at some point may need palliative care, you can certainly look into palliative and or hospice. So just like palliative care, a hospice team also involves a nurse, a hospice physician, social service, chaplain, bereavement services to the patient and family, and ultimately other durable medical equipment, ultimately make that person comfortable, let's say it during that time. For example, one of the durable medical pieces of equipment could be a comfortable bed or anything just to ultimately help make them comfortable. For example, medications for comfort may be introduced, and volunteer services are also involved in hospice care. Now, one of the laws that was introduced back in 2015 that I wanted to introduce is the End of Life Option Act. So the End of Life Option Act is a law in California that permits a terminally ill adult, for example, someone with end-stage brain cancer, could be quite possibly an illness. The law allows a terminally ill patient who has capacity to make decisions to be prescribed in basically what would be an aid in dying medication, that if certain conditions are met. So this law was signed back in 2015 of October by Governor Brown back then, and the law went into effect on June 9th of 2016. So California was the 5th state to authorize this law as an option. So this law ultimately excludes persons with Alzheimer's disease. Obviously, someone with Alzheimer's disease does not have the capacity to make this decision to enact this law. And the Advanced Health Care Directive that I've been talking about, as you can see there, doesn't authorize the end-of-life option use. So ultimately, this act requires someone of capacity to be able to imbibe or swallow the aid in dying prescription on their own. Now, we, as the county, ultimately we are neither for or against this law, but we just wanted to bring this law into light just to make persons aware that, yes, in fact, this is law in the state of California. But in order to enact this law, it has some very strict requirements in order to, if someone does have a condition that if they do in fact want to decide to enact this law, they must be an adult and resident of the state of California. They must have a terminal illness. So whether it be advanced brain cancer, again, it cannot be advanced Alzheimer's disease because someone does not at that point have the capacity to enact this law. They must complete letters of stating that they are suffering from a terminal illness and stating that they do in fact are aware of the different healthcare alternatives and are ultimately making this decision. They have to require letters from a physician that they do have capacity, that they do have the ability to make this decision. Then further oral requests must be made to say, yes, we want to, and I want to enact this law. I have capacity and have the ability to make my own decisions. And then another written request, or what's considered a final attestation, basically saying that they want to move forward. And then, of course, that making this decision, an attending physician will counsel someone on the possibility that it may not be immediate, that death may not be immediate, if and when they do imbibe this prescription. And a physician is not allowed to aid the person in actually taking the prescription. A physician may be able to be present at the time that someone imbibes the aid in dying prescription, but no other family members or friends must be allowed or can be allowed in the same room at that point. A person that is making this decision does not have to include any other persons in this decision. Person that is enacting this law ultimately can rescind this aid in dying, obviously, act at any point during that process. And that is ultimately kind of the most extreme of healthcare decisions. But really, again, that's just an example that if someone is suffering to the point where they aren't able to have a good quality of life, that they have that law or option available to them. But really, again, what it boils down to is what's most important to you and what's most important of your wishes at the point that of healthcare decisions or a medical condition that you may have just been diagnosed with, and what are your decisions quite possibly at the end of life. So really having these conversations and choosing an agent and completing an advanced healthcare directive is so critical. Choosing a healthcare agent is just as important in the process. So choosing an agent, or what otherwise someone known as a healthcare proxy or healthcare decision maker on your behalf, must be at least 18 years of age and older. You can have a primary agent or a secondary agent. So you're not required to have a secondary, but it's always good to have I guess what would be considered a backup. Someone should be reliable. The last thing you would want is a healthcare decision maker that never answers their cell phone. That would not be a good idea, because especially if you are admitted to the emergency room or hospitalized, you want that healthcare proxy to be readily available by phone, and recommended to be local. or someone that's available to be present in person at that point if a hospital decision were to be made. Yes, obviously it is able that someone can have a decision maker in another state or living in another, state of California or a state of in the United States, for example, and some have to have it, and that's okay too. But someone should be reliable and able to be contacted. The one critical piece in choosing an agent is that you must tell the healthcare agent that you're choosing them. A lot of times, and family members assume that someone, because for whatever reason, that whether they are the eldest in a family, the siblings, or a spouse, that they are automatically the decision maker. A decision maker may not be ready for that position to make decisions on your behalf. So again, having the conversation before and making the decision of choosing that person should be known. Ultimately, a physician or a representative in your doctor's office cannot be chosen as a healthcare decision maker or proxy. Because when you're choosing an agent, again, you really want to choose someone who's trustworthy, who really at that point, if that time were to come, is not going to change your healthcare decisions on a dime. And really, you want someone that's really going to have what's in the best interest of you if and when that time comes. You want that person to be assertive and able to make and manage conflict, especially if there's many involved in a family party, for example, or a decision makers. You want that primary decision maker to really to say, I want to make sure I'm following the healthcare decisions of the person I'm advocating for on their behalf to the T, or they have given me the option to change the decisions if I want to, or they have given me full control because they understand that I'm going to be making these decisions on the best interest of them. And again, you want that person to be internally strong, because we find all too often, at least in my experience, working the different healthcare settings, that you have many parties involved in the care of someone. You could have multiple family members involved, and some of them may not be on the same page, for example. So it's important to have those conversations, we'll get into this a little bit later, all together, so that everyone is on the same page and understands that the primary decision maker is going to be making those decisions on your behalf, and those good decisions on your behalf. Because the role of the healthcare agent and those good decisions can include where you will be for care. We'll talk to a physician. We'll help to make the decisions in what's called a multidisciplinary team. If they're in a hospital setting, if they're having a conversation about your future care, all the things to help advocate for you, again, if you are not able to advocate on your behalf. So they are going to be really that advocate and strong advocate for you when that time comes. Now, having the conversation. So as I alluded to at the very beginning, having the conversation is probably the most difficult, or starting the conversation is the most difficult part of the process. A lot of the times people know what their healthcare decisions are very early on. They know what they want and they know what they don't want, but they may have not shared it with somebody else, or they may not, someone else may not know what that person's healthcare decisions are. And it, a lot of the times, is fear. It may be culturally based, for example. Talking about end of life and talking about healthcare decisions is a lot of times not discussed in families or other cultures, for example, or among friends. So really having to start the conversation, and maybe some good ways to start the conversation would be after a doctor's visit. Maybe just sitting down with that person and saying, you know, after this visit, I really wanted to just kind of get the ball rolling on my healthcare decisions, because if something more serious happens to me, I want you to be able to know, and others to know, what my healthcare decisions are. Or if, for example, there was a death in the family. We really, are saddened to hear about the death and loss of this person. Maybe we should really start thinking about what what decisions you want and what decisions I want. So it could really be kind of a back and forth to know that just everyone's starting to think about the decisions ultimately because of the loss of someone else. It could be the loss of an actor or a professional athlete that you may have seen on TV. Wow, that person was, it's too bad that we, lost that figure. Maybe we need to start having these discussions about what happens. It's surprising that this person was lost. We don't want surprises in our family, or I don't want surprises to happen to a friend. Let's start this conversation now. And there are a lot of resources out there available to start the conversation. I myself at my office, interesting enough, there are these cards, or what they call playing cards, to actually help create the conversation with a game. It just has questions that people can kind of initiate and start the decision making and conversation. Well, not start the decision making because someone's decision may be already made, but having those decisions and bringing those questions out to light, and also having a light conversation, because this conversation ultimately isn't light. It's a very heavy conversation, which is the reason why all too often people don't want to have this conversation and ultimately have it maybe when it's a little too late. Now, having the conversation, I like this slide because really a lot of the times we don't have this conversation during these group situations or group gatherings like a holiday, a Thanksgiving. But what better way? I'm planning to discuss this during my Thanksgiving holiday, because this is about the only time that all of us are in the same room, that we're all together during this period. But yes, granted, we obviously wouldn't talk about it during the actual Thanksgiving dinner, but maybe having that good opportunity that everybody's there. Now that we are all here in the same room, this is what I wanted to bring up, because we may not ever have this opportunity to have us together, so that you all know what my healthcare decisions are if something were to happen to me. Now, once you've had that opportunity to bring decision makers and others involved that you want to have and make known of your healthcare choices, is to also talk about those end-of-life decisions, and really breaking down if I were to pass away, if my life ended, these are the decisions I want. I've actually been paying for a burial at a cemetery for a long period of time. It's surprising to know that a lot of families and loved ones, adult children, relatives may not know that someone has been paying for a burial site for a long period of time, or that someone has a plot or a space in a morgue, for example. A lot of times people get surprised that those decisions are already made and people have been paying for those things for a long time. So getting those things in order and making those documents readily available so that people know where to access it and know that yes, in fact, that those decisions and arrangements have already been set. Again, it really comes down to what decision you want with regard to the celebration of your life, for example. If you want it in a church setting or in an outdoor setting, or how you want to be buried. Again, there are different options that people can choose for end of life. Again, even if you want trumpets to be played at your celebration of life, that's really those decisions and things that you want people to know during this conversation, so that people aren't surprised or people don't know about what your decision choices were to make at your end of life. Now, there are many other documents in many other ways, excuse me just for a moment, that persons can have the conversations and further discuss these healthcare choices in various documents. There's a document called the 5 Wishes, which really breaks down kind of healthcare, advanced care planning, healthcare decision choices, and really has some great kind of stepping stones and questions to bring up during the conversation. I believe it's about $5 online that you can download to really get the conversations going. You may have already completed a Advanced Healthcare Directive or a power of attorney for healthcare, excuse me for just a moment, my phone, let me just turn that off. So you may have already completed an Advanced Healthcare Directive in a trust. Some of you may have a trust with regard to finances, and you may have one that's related to healthcare. So, oh, sorry, it looks like I accidentally switched out my screen there. Sorry about that. Let me get back to my screen. There we are. Then there's a living will. What a living will is if you ultimately decide that you don't want to have a healthcare proxy or decision maker, you could just basically document a living will and state, these are my wishes. These are my choices. This is what I want and what I don't want. I've decided I do not want a healthcare decision maker to speak on my behalf. I want to document all my decisions from if something were to happen to me, and of course, my end of life. And then last, some of you may be familiar with the pink form that you see there on the slide. That is what's called the POST, or Physician's Order for Life-Sustaining Treatment. Now that is a different document compared to the Advanced Healthcare Directive, which is what I've been talking about this entire time. But the POST, or pink form, is a two-sided sheet that, yes, in fact, does state your life-sustaining measures, whether somebody wants CPR or all full life-sustaining measures, and or artificial aggressive treatment in nutrition, for example. And that pink document is actually signed by a doctor. So that document is typically completed for those who are or may have an illness or a more advanced illness that requires that document to be accessed immediately. Now, it's highly encouraged that actually people can have both the California Advanced Healthcare Directive and the POST. But this, if you're not or don't have an advanced illness, this will certainly suffice at this time. So as I showed you, this is the California Advanced Healthcare Directive. Now, Mark will be providing this PowerPoint. It will be available in PDF, so you can click on a link that directs you to the California Advanced Healthcare Directive, or you can just go online and just type in California Advanced Healthcare Directive to print a copy online for free. So this is the copy that we distribute at Aging and Independent Services out in the community. So you would complete the document, you would sign it at the very back. You would either have two witnesses sign off that you completed the document, or you can have it notarized. So either one makes the document active and able to be referenced. So what would you do after you complete the document? So you would make multiple copies. You can obviously complete and keep the original. You would provide a copy to your primary and or secondary healthcare decision maker. You would provide a copy to your physician, and we would suggest to provide a copy to your hospital of preference. A lot of hospital settings actually already have and require you to complete an Advanced Healthcare Directive. Some require it to keep in your medical file, because at any point that you are admitted and hospitalized, they will ask you for an Advanced Healthcare Directive. The last thing obviously you'd want is to have to complete one while you're in the hospital recuperating or for whatever reason, or admitted for whatever reason. So it is important to have that ahead of time and completed so that hospital preference has your healthcare decisions. Another recommendation, this is my refrigerator actually, is that a copy of the Advanced Healthcare Directive as completed should be magnetized on the fridge, because the last time I was with you and talked about the vial of life, which you can see there is magnetized on my refrigerator, which has your health history, list of medications, healthcare decision maker listed, should be next to a copy of the Advanced Healthcare Directive. Now, if you don't want to put it in front of your refrigerator, you can also put it on the top, because the first responders, including emergency paramedics, fire department, typically will look to the fridge to see if that information is listed on there for emergency information if they need to send you to the emergency room. One of the things that is encouraged once you've had at any point the advanced care planning discussions and completed an advanced healthcare directive is to review your information. So I mentioned at the very beginning that at any point, the decisions can change. And this document that you completed, the advanced healthcare directive, can be shredded and can be totally redone at any point. Now, it should be recommended that maybe every 10 years that it be reviewed and maybe redone if needed. If there's a recent death in the family, that it should be revisited to make sure that everything is in line and your decisions are that you made back when you completed the form are still the same. If there's a divorce, that healthcare decisions may be revisited. And of course, if there's a new diagnosis, that healthcare decisions may change, that the conversation and completion of the document should be updated. And if ultimately, if there's a decline in health and decisions are changed, that an advanced healthcare directive at that point can also be updated. Now, there are some great resources out in the community. I myself am part of the San Diego Coalition for Compassionate Care, which is a volunteer community collaborative, which educates the community on palliative care and advanced care planning. The San Diego Coalition for Improving End-of-Life Care is a collaborative group in the community that also educates our community on end-of-life and end-of-life care and choices. And as I mentioned, alluded to earlier, the San Diego Institute for Palliative Care at San Marcos is one of the leading schools in the nation on palliative care education and bringing on and educating leaders, future leaders in the area of palliative care. Other means of support that people can reference is Aging and Independent Services. Obviously, if someone needs a copy of the Advanced Healthcare Directive. If you are admitted to the skilled nursing facility, for example, and you need to complete or haven't completed an Advanced Healthcare Directive and may need a witness to see that you have completed one, you could ask for a long-term care ombudsman to actually come to the skilled nursing and actually witness that you've completed one. If you need further kind of legal advice, the elder law and advocacy may be a good option, including some other resources included there that may be of help. These are the additional materials. So again, you'll be able to get this PDF version and click on these links for further info. I really like the Conversation Project, which has a lot of firsthand accounts of people, whether it be family members, spouses, loved ones, friends, their experience having the conversation and having advanced care planning discussions and completing the document from a multitude of different backgrounds. So I really enjoy it. So if you want to reference it, it's a great website to view. It's called the Conversation Project. The 5 wishes, there's the 5 wishes there. You can even call 888-5-WISHES to get a copy of it. Again, I think it's around $5. And then Finding Your Way, a guide to end-of-life medical decisions. If you really want to get down to medical life decisions, can reference that. And then, as you can see there, I provided a copy of link to the California version Advanced Healthcare Directive, and also a link to copy the PULSE, the pink form, which I referenced earlier, if you ultimately need and want to complete a copy of that as well. Now, everyone should really start to think about these decisions. And if you haven't, I suggest to start today. If you have already completed your documents, revisit them if you need to. Make sure that your decision makers are still on board and still in agreement with your healthcare decisions, and really to make sure that your wishes are respected and that your decisions are, if and when that time comes, to be known and to be shared, because they're your decisions and what you want with regard to your healthcare choices. So with that, I am going to unshare my screen here and see if there's any questions that folks may have.
Well, first of all, thank you so much, Matthew. Very excellent presentation. And I was fortunate enough to lean on a lot of the resources that you mentioned for a loved one who was recently in hospice. And I felt so much more prepared in dealing with it, with not only informing myself, but my family members as well. So this is a very timely presentation for myself, and I think for everybody that in attendance. We do have one question, but before we get to that question, I'm going to share the screen real quick. Matthew pointed out that we do have a PDF version of his presentation today. If you would like a copy, all I ask is that you send us an email, real easy, resdec@resdec.net, and I will be happy to forward you a copy. And I'll show you what that presentation looks like and show you how interactive it is with some of the information that Matthew talked about. If I can find it. So as Matthew mentioned, you can actually click on the link itself that is there for one of the additional materials or resources, and it'll take you right to their website. This is the Aging with Dignity website. So it's a great tool and a great resource for you. And again, all you got to do is shoot us an email at resdec@resdec.net, and we'd be happy to get one right back to you. And now for the question. When was the last time the California statutory language for the durable power of attorney for healthcare and advance directive was updated?
That's a good question. I have I don't know the exact at any point that the California Advanced Healthcare Directive has been updated. The version that I have with me is dated 2015, so I don't anticipate there have been any more drastic changes to the California Advanced Healthcare Directive. But I really, if it's a preference, I would really suggest that the California version to be completed. I really like that it's very simple in completion of it. With regard to healthcare decisions, it's in bolder point, and the sentences are separated to really help to navigate and really ease to complete the California Advanced Healthcare Directive. I completed one myself. It's very easy to. I've asked other family members to do so. But as far as updates, again, to answer the question, I can answer that, in fact, if and when changes were made, but I have not heard or seen any recent or major updates with regard to it.
Well, I do not see any other questions. So once again, Matthew, we appreciate your partnership. We appreciate the great information that you shared. And lastly, I want to thank all of you who joined us today, and thank you for your membership. We look forward to bringing you another presentation next month and the month after. So September and October, we'll have two great presentations. And you know what? I'll do a plug for those real quick before we go. So just give me 1 second here. Once again, to highlight our website, just go to www.resdec.net, click on ResDec Events, News and Events, ResDec Events, and you can find out when the next presentations are. Next one will be on Tuesday, September 14th, same time, 10 a.m., mandated abuse of elder and dependent adult abuse. Now, is that you, Matthew? I can't remember. Is that one of your colleagues?
That would be Annabelle Kirkendall.
That's Annabelle, okay. And then the last one on October 12th is Alzheimer's disease and other dementias. I believe that's you.
That's me, and I hope you join us for that. You'll be seeing an orange and toothpick demonstration that I will be sharing with you. So I hope that you look forward to seeing that demonstration.
Excellent.
With regard to Alzheimer's disease. So
that's great. You're welcome. Well, thanks again, everybody. I'm going to go ahead and end the meeting. Really appreciate you guys joining us today, and hope to see you all soon via Zoom, and hopefully even more in person at some point. Take care, everyone.
Thank you very much, everyone. And thank you, Mark.
Thank you.